So my name's Louise Senior. I'm the matron in surgery at Milton Keynes General, and I look after all of the emergency surgical areas. So that is Ward 23, Ward 20, ophthalmology and ENT. So I've worked as a qualified nurse for 16 years, since 2004. And I've worked for the trust since then, and I was a student between here and Northampton before that for the 3 years. So I needed my basic GCSEs, so your maths, English, science, and the requirements for entry level into university. Then at A levels, they wanted 3 A levels at a pass level or above. So back then it was a C or above. I think now it's on the grading of a 1 to 10. And then I entered into university on the degree pathway. At that time, you could get a degree or a diploma pathway, and I entered on the degree pathway, and then qualified in 2004 with a 2-1 degree. My favourite thing about working for the NHS is the team working that I have with my colleagues, the atmosphere with the colleagues, and of course my number one thing is my patients. So the patient care and compassion, and the joy it gives me to go home knowing that I've looked after somebody well, and that could be either in their worst situation of their life, that I've done the very best that I can for that patient, or from seeing them get well and go home again. It is when it doesn't go well, and when that patient is really unwell, and it's very distressing for the family, and it's really hard. As nurses, we want to save everybody. That's what we like to do, and we can't always do that, and sometimes that can be quite upsetting. But it's important, again, to remember and go back to the fact that you've done everything that you can for that patient. It is looking after my patients. I do enjoy my job. I enjoy my job immensely, and it is seeing those patients be happy with what you've done with them that day. But also from staff. So in the position that I'm in now as matron, it's making sure that my staff are happy, and that they have all the tools they need to look after their patients, and just making sure that actually the staff are well looked after and that they're well developed. I reckon it would be to give it a go. Go and have a try. My career started off during my A levels, actually, and I did health and social care at GMVQ level, and I attended a placement at a local hospital, and initially I wanted to be a midwife. I went to my local hospital on the maternity unit, and then I went on to an adult geriatric ward, and I loved it, and I completely changed my idea of a career and where I wanted to go, and then went into adult nursing. So I think it's really important to experience those atmospheres, those environments, to see if it's for you, and to make sure that actually it solidifies what you would like to do. If you can go and get, you know, some experience in those areas, it's really, really important. And that for me during that time was so important, because it determined then my career pathway and where I wanted to go. So I think it is just to go with enthusiasm, go with an open mind of, this is, you know, you're here to learn and here to experience, and so soak it all in and take in everything that's been offered to you, and to try and motivate yourself to learn. One word is very difficult. Proud. I'm proud to work at MKUH. It is a great team, a great hospital, and a great trust, and I'm proud to be part of this trust. Thank you very much, and goodbye.